We're doing our dental today. I have my patient here. He's anesthetized. He's hooked up
dry though, isn't it?
His monitor.
Yeah.
His head is underneath
All right, I'll let the doctor know.
Has a towel underneath it to keep it comfortable. His body also has a towel underneath it as well. His eyes are lubricated. I have all of my supplies here. I have my ultrasonic cleaner. I have the polish. I also have my probe and any 2x2s that I'll need. I have my sealer as well. I have my PPE, which is my gloves, my mask, my hair, or my cap, and my glasses. So what I first initially do is once we're here, we go ahead and do kind of an oral exam. We're looking at kind of lesions, broken teeth, anything that needs to be addressed while we're anesthetized. I look at all the teeth, I look at the tongue, I look underneath the tongue, the roof of the mouth, anything like that. And everything looks good. I don't see any missing teeth either at this point. Obviously, I'm going to mark everything down if I am missing anything. So I'm going to begin with the cleaning. There isn't a large amount of calculus that I would need forceps to take off, so that's not needed at this time. When you begin, you go ahead and use it at an angle, and you only use it a few seconds on each tooth at a time. It does heat up, so you cannot keep it on a tooth too long, otherwise it can damage the tooth. So you're not going to do it head on, you're going to do it at an angle and start at the base and work your way to the tip of the tooth. So I'm going to go ahead and begin. So once we get that all going, once we clean it, then we will polish it and rinse it in between each one, looking for anything. I will probe each tooth as well, make sure there's no pockets or anything. So now I can go ahead and begin. I am going to get underneath the gum tissue too while I am cleaning to get any of that tartar that might be underneath. So again, only a few seconds on each tooth. So that way we are sure we don't harm the tooth. Then you just methodically work on one and work your way back to the next tooth so you don't miss anything. I'm going to put some gauze in the back of the mouth just to make sure that we don't put water in the back of the throat. So I'm going to count how many gauze I put back there, which will be 3. So I make sure I grab that too. This is so the patient doesn't swallow an excess amount of water. And you may see some mild to moderate bleeding. That's pretty normal. Obviously, if there's more than that, you just have to let the veterinarian know when they do their assessment as well. As of right now, it looks like these teeth are going to clean up pretty nicely. So while I'm on this side, I'll do the fronts of these teeth. I'll do the incisors. I then will open up and do the insides of the opposite side. So the left side, I'll do the insides of those teeth as well. Usually you won't see a whole lot in there, but some dogs or cats will also have a lot of tartar on the inside of their teeth as well. So, once you clean an ultrasonically clean that side of the mouth, what you're going to do is I'm going to polish this side. So we go ahead and get some polish on. I'm going to put a little bit and polish each tooth. Then we're going to rinse in between. Rinse all the extra debris, any calculus, anything else like that off, and tartar. I'm going to take those out, those sponges. And we'll take my probe then and look at the ones that I clean. Go ahead and looking down to see if there's any pockets. Probe each tooth. Each tooth looks pretty good. So once I'm done with this side, we'll flip and do the other side and do all 4 quadrants of the mouth. Again, cleaning and polishing. Once we're completely done, we'll clean everything else off, and then I will seal it with some Vett, and then our patient will wake up and wake up from anesthesia and get ready for home. I also do have to go home kind of a report card of what we found in the mouth. This is where we'll write down if there's any masses, if there's any pockets, missing teeth, any teeth that we had to extract. At this point, on this side, it does not look like we're going to have to extract anything. If there's any epilus or fracture, hyperplasia, anything else like that. Also, if there was any kind of pain meds that we needed to send home. Obviously, we always tell patients about home brushing and what they can do to help keep the tartar and calculus from building up on their teeth after they just got a dental. And so there will be some home care instructions, and then this patient can go home with some nice clean teeth, and then they can be set hopefully for a while until their next dental.